let's be practical since you used that term earlier. Somebody walks through your door, or you have a friend or family member, and they're like, "Okay, you sold me, Doc. I'm convinced this is a good thing to consider. Can you just give us just some practical dietary changes you would recommend that they start on?"
Yeah, absolutely. One of the main ones that was really eye-opening for me personally was cutting out those in-between meals.
Mm,
And thinking of like we tend to sip on things, or we just have things sitting there. We when we're anxious or we have a lot of work to do, we want something to munch on. We're just kind of constantly eating. And once I realized that, that was a big game changer for me. And it's something I still pay attention to now. When I start doing that, it usually means that something's off. I'm emotional about something, or I'm, trying to do too much work at once, not taking breaks. And so I usually tell people to just start cutting out those snacks, and if you feel like you don't snack, you probably do. You just don't think of it as a snack. So once they get that, they're like, "Oh, you're right." I'm like, it's just collect your meals together. Eat.
mm-hmm,
If you're gonna eat 3 meals a day, that's fine, but eat and then be done between. And then when you go back to it, eat and then be done, and make sure you're eating enough. Something else I tell people to look at is the actual quality of their drinks. So,
mm-hmm,
you probably were in the time frame when they were talking about pop, and like if you were going to do the artificial sweeteners, it was better to do the regular
mm-hmm,
pop with sugar in it, which is when they started putting real sugar in it. And
mm-hmm.
I did that for a while, and then I was like, not when I started doing this, I was like, that wasn't so great. But what this lifestyle has taught me is the quality and thinking about what that sweetener does. So, of course, sugar is going to raise your insulin levels and cause problems and things like that. So, when you have that between meals, you're eating basically, and
Mm-hmm.
your body thinks you're eating. So,
Mm-hmm.
you're kind of opposing yourself. So, if you have something like that, it's best to have it with a meal. But I recommend getting rid of those things, anything that can potentially spike insulin, anything that can give you cravings, because even though the artificial sweeteners don't increase your insulin per se, they do stimulate cravings in some people. And so that's a big thing that people do that they don't realize that they're doing, and that it's just a small shift. Sometimes not so small of a shift, but a small shift that they can do that's relatively easily. And then the only other thing I'd say is don't think about what you can't have. If you go in with that
Mm-hmm.
mindset, it'll be really hard, because it's like, then you're on a diet, and we're trying not to be on a diet. We're trying to get away from dieting. So, just think about things that fit in that you love and focus on those, and keep it really simple in the beginning. And then over time, you can start to experiment a little and have fun with the Diet Doctor app and all that stuff. But yeah, those are the main things that I would say are easy to get you started that can take you a long way.
You may have to call or channel your parents, because I think you're my sister, because everything
Right.
everything you just said, I'm like, wait a minute, is that me talking, or is this
Right.
Dr. Mila talking? Oh my God, I'm sitting here like, oh my God, I feel like I'm listening to myself. So I love your responses
Yeah.
because they make a lot of sense. And thankfully, when you eat the way we're describing and you get real nutrients in your body, you probably won't even be hungry for
Hmm.
snacks. Some
Hmm.
of it is what you see, so get it
Hmm.
out of sight. Some of it is so if I see peanuts on the counter, I'm going to want to eat them,
Hmm.
right? So
Hmm.
maybe they shouldn't be on the counter. And then the other part is that I don't feel hungry, so
Hmm.
that's really important. Um, I also like this idea of you're saying, well, you're going to get a little bit of a insulin spike if you snack, right? No matter what. So, and even if you don't get it from the artificial stuff, you may have that urge, or that, it may trigger you. But I love that insulin spike, because what people need to understand is that too much insulin, if you're literally working your pancreas all day, eventually it's going to get tired, and
Hmm.
years later you may have borderline diabetes or diabetes. But you become, too much insulin, you become insulin resistant, and ultimately that leads to metabolic disease. So,
Hmm.
and metabolic disease is your blood pressure, your diabetes, your risk for cancer, your risk for dementia. So all of that makes sense, and I love your simplicity, because I found that in my practice, if it's not simple, if it's complicated, it overwhelms people.
Hmm. Hmm.
And even though I give them a handout that says eat this, don't eat that, the goal is you decide what to eat.
Hmm.
I don't tell you what to eat. even though we love diet doctor because they give you recipes, and some people need that.
Mm-hmm.
But a lot of patients just here's a list of eat this, not that. You decide what that's going to look like. And yes, as you suggested earlier, chicken and broccoli is not some crazy diet that we should be afraid of, right? Steak and asparagus, that's not going to kill you. So we have to really kind of help people understand what we're talking about here. And I guess the other thing I would say really quick is um, you don't have to be in ketosis to do well. I mean, some people, they're like 300 or 400 carbs and they're down to 100 and they're doing phenomenally well.
Mm-hmm.
So you don't have to be in this magical less than 20 carb place. Some people say less than 50. No, you just have to reduce your carbs compared to where you were. And we don't know what that number means for individual, but that's pretty much what you need to do. So let's not get crazy and obsess about, am I in ketosis?
Right.
Unless you're epileptic or something, that's not really the point. So thank you for that.